Hey, it's Melanie. I just wanted to jump on and say thank you so much for listening to the Eat Away Kidney Stones podcast. I've been truly blown away by all the kind and wonderful comments people have been leaving for me about the podcast. If you are enjoying the podcast, please consider leaving a review on whatever platform you listen to your podcast on. This really helps me help more people prevent kidney stones. I hope you enjoy today's episode. Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. All right. Welcome to this episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today I am thrilled to invite actually my personal dentist to the podcast. We have Dr. Mimi Salem on the podcast today. And during my last appointment with her, I was just chatting about food as I tend to do as a dietitian, and specifically wanted to mention the podcast to her because a lot of my listeners and my students in kidney stone nutrition school have been saying that their dentist isn't thrilled that they're drinking a ton of lemon juice. And so that is why I really wanted to have a dentist on the podcast to kind of talk to us about that. But honestly, through my conversation with her, literally at my appointment last time I saw her a couple months ago, I learned that there is a ton of connection, even more than I knew, between food and nutrition and oral health. And so we're just going to be talking about everything food and teeth and mouths today. And I'm super, super pumped because I feel like I'm even going to learn a ton. So welcome, Dr. Salem, to the podcast. I am so excited to have you.
Thank you, Melanie. Thank you for having me today. I'm super excited to talk about this because, like you said, I don't think that people realize how important diet is and oral health. So I'm excited to be here and I'm excited to, talk about all of it.
Yeah, excellent. So let's kind of start out by just kind of giving the listeners an introduction of who you are, where are you, where'd you go to school, all of that sort of stuff.
Sure. So, like she said, my name is Dr. Mimi Salem. I have my practice. The practice name is Freshworks Dental Studio, and I'm located in the North Center, and that's Chicago, Illinois. I actually grew up in Illinois. I was born in Chicago, raised in the Chicago suburbs, and moved back here shortly after dental school. And I'm just a Chicagoan through and through. I completed my undergraduate degree at Loyola University, and I continued on and got my dental degree at Midwestern University.
Awesome. Awesome. Well, thank you again so much for taking time to hang out with us today. I'm so excited. So let's just kind of just jump right into kind of the big picture. How are our teeth and our mouth related to health in general? Like, because I feel like a lot of people think like, oh, like your teeth are gross, but like, that's it. Your teeth are gross and like no big deal. But it sounds like there's actually a much bigger connection between health in general and mouth health.
Absolutely. So essentially, our mouths out of sight, out of mind, they're functioning the way they should function. A lot of people really don't think about how they truly are the gateway to our bodies. And anything that we consume can actually have a great effect on our oral health and also our systemic health. So many people don't realize that early detection also of some medical conditions can actually show up in the mouth first. And that's why it is so important to make sure that we're taking care of our oral health and that we really know what's going on in our mouths. Because, education, prevention, detection is truly key.
Yeah, absolutely. And that's true. I feel like for basically any medical condition, the sooner we know about it, assuming there's something we can do about it, which obviously most medical conditions we can, that's key because then your outcomes are going to be better. We'll be able to, detect it early, intervene early, and make you a healthier person, right? It wouldn't be as bad as it would have been otherwise.
Exactly. And our body is so interconnected and everything is so linked. Sometimes we can even detect things early in the mouth. There can be signs and symptoms in the mouth that show up first before they show up systemically. So that's why it's so important to really take care of your oral hygiene, to see your dental provider, and to really understand what's going on in our mouths.
Fascinating. What are some of the most common conditions that you identify early as a dentist that you see in your practice?
So, a big thing is really gum disease. Gum disease can start so early in people's mouths, and it can lead to the progression, which we then call periodontal disease. And once it gets to periodontal disease, it can have major effects on our mouths, on our bodies. So we essentially want to make sure that we're doing everything we can do to prevent the progression of gum disease. And, there's a lot of ways that we can do that. Two big factors would be diet, which obviously, and oral hygiene. So, it's multifactorial, but those are really two big factors that can allow us to prevent, gum disease from progressing.
What is the definition of periodontal disease? Like, what's the difference between that and just gum disease?
Just gum disease. So gum disease is when, you're starting to see signs of inflammation in the mouth, essentially a little bit of bleeding, a little bit of gum irritation, and, your gum, and you tend to build up plaque, a lot quicker, easier. And if it's not being removed, your gums do get irritated. Periodontal disease is a bit more of a progressive disease. It essentially is when there's inflammation in the gums, which causes plaque to mix with bacteria, mix with bad things in your mouth, and that plaque tends to harden and become tartar, or what we call, in the dental field, calculus.
Mhm.
Um, that calculus can tend to sit on our teeth. And if it's not removed, it can tend to get dislodged underneath our gums, and it can sit there. And our gums are attached to our teeth. So that tartar sitting underneath the gums can cause those gums to disattach from our teeth,
Mhm.
causing more inflammation and also causing essentially bone loss. And the bone is really what holds our teeth in place. So we don't want to lose bone, and we want to make sure that our gums stay healthy. Once we get to a point where periodontal disease, comes into play, it could really affect you systemically. That bacteria can get through your bloodstream. It can get into organs like the kidneys, and it can cause some big effects on your health. So, gum disease, where periodontal disease is preventable, and we want to make sure that early detection is truly key.
Mhm. Yeah, fascinating. There's so much to know.
A lot. There's a lot.
So much to know.
I know.
Um, and just to make sure that we touch on it, when you say oral health, is that really, certainly we're going to talk more about diet and food in a little bit, but does that really come down to like brushing your teeth and flossing? Really that
Well,
simple?
I mean, that's a big factor, right? However, oral health is really truly multifactorial. There's so many factors that can affect your oral health. And, some of those factors can be whether it be genetics, is this something that you may be predisposed to? Or is it oral hygiene? Are you not taking care of your teeth the way that you should be? What does your diet look like? What does your lifestyle and habits look like? And, are you seeing your dentist regularly? What are you consuming? These are all important factors, and there's plenty more, but these are some of the main factors, that you want to discuss with your dental provider and make sure that you really take into account when it comes to oral health.
Yeah. Yeah. So much to know. Again. All right. So let's move on to food more specifically, since I am a dietitian and people here are generally interested in food and nutrition.
Absolutely.
So what are some of the specific ways that food or our diet in general can impact the health of our mouth and teeth?
Sure. So obviously a balanced diet is going to be very important. Just like anything, you want to eat healthy, you want to watch what you're consuming. Obviously as a dietitian, each patient has a different kind of diet plan in place geared to their needs. So of course, that's going to be number one of importance. Each patient needs to make sure that they know what their dietitian or healthcare provider wants them to consume. But some really important things in the dental field is, eating eating vegetables, eating fruits, eating whole grains, low fat dairy, lean proteins. And, these things can really truly give us the nutrients that our mouths and our teeth need. And they also have a lot of natural things that they could do for us, right? They can help cleanse our teeth. They can help keep our enamel strong. There's so many things that, are in food, like calcium, vitamin D, fiber. These things are so important for the mouth. So just making sure that, you have a really good, well-balanced diet.
Yeah, I love that because certainly in kidney stone nutrition, we get it's easy to go down the rabbit hole of oxalate and I need to have this much calcium and I need to have exactly that, like, but really for the vast majority of people, kidney stones included, it's really just eating a healthy, balanced diet, like you said. Like if we just start there, 90% of people are going to be totally fine. And when it comes to, eating a general healthy diet. It's a dietitian's secret. Like obviously we're important and everyone's different. But if we can just get people eating fruits and vegetables and that non-fat dairy is especially important for stone prevention, eating the right amount of protein, blah, 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 like you're going to be doing really, really well if you can just get that in.
I mean, essentially, we are what we consume, right?
Yeah. Yeah. Awesome. Okay, so you had a couple things that you wanted to make sure that you touched on for food and dental health. So do you want to dive into those a little bit more?
Yeah, totally. So, obviously consumption is a big thing, right? And so a lot of times I see patients will come in and, they have more than one of these factors I was talking about. They're on a medication, they're genetically predisposed, and then they're taking in a very acidic or sugary diet. All of these can lead to things like dental caries, or commonly known as cavities, and gum disease. So we essentially want to make sure that, everything within moderation, and whatever we're consuming, there's ways that we can care for our mouth to make sure that our teeth and our mouths are not affected by what we consume.
Mhm.
So I know lemon juice is a big one for kidney stone prevention, and cranberry juice and some other things that, a dietitian may recommend for patients with kidney stones. So lemon juice has, I mean, a plethora of benefits, right? I mean, lemon juice is fantastic. However, it can
Delicious.
really, it's delicious. I love lemons. I didn't say that, but Um, so essentially, we can consume lemon juice or lemons in a safe way to make sure they don't have long-term effects on our teeth. And ways we can do that is, when are we consuming this lemon juice, right? So, if you're consuming it in the morning, you want to make sure that you're not brushing prior to consuming the lemon juice or immediately after. So the rule is to wait about 30 minutes to an hour before brushing, because what essentially the lemon juice does is it's extremely acidic. It can actually sit on the surface of our teeth and it can wear down our enamel. And our enamel is really the strongest substance that protects our teeth from all of these bad things like bacteria. So we want to make sure that if we are consuming lemon juice, we rinse with water after the consumption, swish around for about 30 seconds or longer, and make sure you hydrate. Hydration is a big thing that I definitely want to touch on, but make sure that you drink some water after the lemon juice. It'll help rinse off that juice, the acidity on your teeth, and then just wait the 30 minutes to an hour. Essentially, our enamel gets soft from the acidity, and it also kind of opens up the pores in those teeth. So if you brush too quickly after lemon juice, you can actually abrade your enamel, and lemon juice can cause erosion. So we want to make sure we maintain the structural stability of our teeth. And those are just helpful, tips and tricks that can help us do that.
So that's so the opposite of what you might think, right? If your dentist says like, oh, you shouldn't be drinking that lemon juice, but you're like, I'm going to anyway because I want to prevent kidney stones. And then you're like, all right, I'm just going to brush my teeth right afterwards to get rid of it. It sounds like that might actually be the worst thing you can do.
I agree. It really
Yeah.
is. So,
Yeah.
other things, right, is like, how are we consuming this lemon juice? Are we eating a lemon? My recommendation is to kind of squeeze it and drink it, maybe even dilute it with water if your dietitian's okay with that. Diluting it with some water so it's not so concentrated and acidic. And additionally, using a straw. I know straws are a bit controversial in the
Get
dental
a metal
field.
one.
Another
You're worried
one.
about the turtles.
I personally love straws. I
I
think
do
straws
too.
are a great way to consume acidic beverages, because essentially it's localizing that liquid, and it doesn't, that liquid doesn't have an opportunity to get on all of the surfaces of our teeth. Just make sure when you are using a straw that you're using your lips versus your teeth, because we don't want, to cause any damage to the actual teeth themselves. But I like straws. Straws are great.
I do too. I just like enjoy drinking out of a straw. I don't know why.
Me too.
Yeah.
So I am pro straws.
Yes, yes. And I have to say, just as sort of like a side note during this whole lemon juice conversation, most people with stones really don't need to be drinking that much lemon juice. We really need to be looking at your 24-hour urine test to see if that's even something that's going to be beneficial for you. Because for some people, it actually could be harmful from a stone prevention standpoint. So it's so, so important to not just sort of blindly read something on the internet and say, oh, I have to have lemon juice. Like it is helpful for some people. But another I tend to go on tangents. Another side note is that the
Yep.
best way to increase citrate in your urine is to actually make sure you're not eating too much protein and be eating fruits and vegetables, literally all of them. And it sounds like doing that, eating lots of fruits and vegetables, eating a well-balanced diet is good for your teeth anyway.
It's
Plus like general health. So
totally,
just if you do need to drink lemon juice or you found that it is helpful, I think these are all really great tips. But I just don't want to add to that noise of like, oh, like, lemon juice is so amazing for kidney stones because it isn't necessarily the best for you. And I have lots of other podcast episodes already recorded about that. So definitely check those out if you're at all interested.
yeah. And, even going back to some of the fruits, right? Fruits do contain sugar. So we also have to be careful when we're consuming fruits. So again, rinsing with water afterwards to kind of rinse off whatever excess sugar might sit on the teeth is also very important as well.
When you
But
when you say rinse, do we have to like literally like swish around water and spit it out, or can you just like drink some water and swish it around and swallow it? Is that sufficient?
you want to be hydrated, right? So I'm all about swishing the water around and drinking it. It's really a preference, but just kind of rinsing it around in your mouth for about 30 seconds is really, key. If you want to spit it out, spit it out. You want to drink it, it's fine. Either way, I think the big takeaway is really just hydrating and rinsing out with water after.
Yeah. Would you say that's good practice after anything you eat? Because I'm thinking about lots of other acidic foods, right? Like tomato sauce, maybe, or I don't know, grapefruit. Like, would you say that's good practice always after you eat pretty much anything?
Pretty much, yes. I would
Yeah.
say always. And obviously, we're not going to sit and brush our teeth every time we have a meal, right? And I know a lot of people are snackers, which
Mhm.
is a conversation, a side topic, but so you want to make sure that at least you're rinsing off with water to allow your mouth to kind of cleanse away all that sugar, the carbohydrates, and the acidity that could be in drinks and food.
Fascinating. This is something I've honestly never thought about. I shouldn't tell you, you're my dentist, but
No, but like simple tips and tricks, a lot of people don't think about these things. We have a
yeah,
lot to think about in our daily lives.
yes.
So it's very helpful to kind of hear from professionals what they recommend.
Yeah, absolutely. And this really fits with stone prevention perfectly because, like, the number one thing we can do is drink more water. Always, always, always. So just make sure you swish around that water a little bit and you're good to go.
Actually is another topic that I really wanted to discuss is hydration and dry mouth. So a lot of patients tend to suffer from dry mouth when they're on certain medications, or have, certain diseases can cause dry mouth. So that's a big thing. Essentially, our saliva is our natural secretions that help rinse things off of our mouths, or off of our teeth as well. So we want to make sure that, we are staying hydrated and we have healthy and good salivary flow. So I know there's a a lot of medications that patients are on, some of them being for kidney stone prevention, or treatment. So we want to make sure that, when you are on a medication, you're reading, the dental risk factors. They're usually clearly stated on medications labels, or you can talk to your healthcare or dental provider if you have any concerns. But essentially, if your mouth is dry and your body is not producing the secretions needed to rinse off that bacteria, the plaque, the things that sit on your teeth, it can lead to cavities, it can lead to gum disease, and it can lead to a lot of systemic issues. So things to look out for, if you think you may be suffering from dry mouth, is your saliva seems to be a bit thicker or more viscous. Additionally, your tongue looks a bit like it has some grooves, or we call it fisher tongue. All of these things can have a big effect on your oral health. So, and so dry mouth, I notice it in a lot of my patients that are on specific medications. So we want to make sure that if you do suffer from dry mouth, you're drinking a lot of water, you're talking to your dental provider about some supplements that you could be using to rinse or help produce that saliva. There's sugar-free gum and lozenges and a plethora of products out there. So, make sure to bring that up to your healthcare provider if you do think you're on a medication that is causing dry mouth.
Yeah. Yeah. Awesome. All great tips. Another thing you had noted here that you wanted to talk about was mouth pH, and I don't think we've talked about that very much. Or is that just in terms of the acidic foods, or is there more
Yeah,
to it than that?
it's really in terms of acidic foods, right? So
Mhm.
everybody's, pH level is so important throughout your entire body. Systemically, pH
Yeah.
is very, and it is especially important in the mouth. So you want to make sure, again, going back to a good balanced diet, being making sure that you're hydrated, avoiding really sugary drinks and substances, rinsing your mouth out with water, cleaning your teeth, brushing them, flossing them, are really big things to kind of maintain the pH in your mouth.
Mhm. And I imagine that if pH is too high, probably that's going to allow the bacteria in your mouth to grow better. I'm assuming that's kind of the why that's a concern to you.
Correct. Yes. You want a
Mhm.
balanced pH, whether
Yeah.
it's too basic or too acidic, it's
Hmm.
going to cause issues in the mouth. So we want to
Yeah.
make sure that our pH just kind of stays regulated and balanced. And again, it goes back to some medications can cause, the differences in pH in your mouth. So you want to make sure that, you're really consuming good, healthy things, really taking care of your mouth in order to kind of prevent, oral health problems.
So moving into kidney stones, this is something that I learned, I think maybe both of us learned as we were researching this episode. There is actually a connection between dental health and kidney stones, at least in association. So let's talk a little bit more about that.
Yeah. So, it is actually really fascinating, but it goes to show you that our bodies are just so, our body is interconnected.
Mhm.
Um, so essentially, there's been studies that have linked tartar and calculus that kind of form on our teeth to being more prevalent in people that do suffer from kidney stones. So essentially, when people do tend to get this tartar calculus that kind of sits underneath the gums and causes what we call periodontal disease, what can end up happening is this progressive periodontal disease, when we test it, we see that there's high levels of uric acid in the saliva, which essentially is very similar to kind of the formation of kidney stones, which you could talk about more than me, but there seems to be a link there. So, if you tend to be the patient that, I've suffered from kidney stones, I haven't had them in a while, but I also noticed that I have gone to my dentist and it seems like I'm building up more tartar. They're cleaning my teeth, they're scraping them a little harder. My gum measurements seem like they're not very stable. It's definitely something that you should consider and discuss with your dental provider as well as your healthcare provider, because there seem to be some clear links between the two.
Yeah. Yeah. It's hard to say, we always think about, correlation, causation, these types of things. And from my understanding, it doesn't seem like we can for sure know what causes the other. Like I was thinking that perhaps from everything we learned today, people who are maybe consuming a diet that's not the best, especially high in sugar, et cetera, that's going to put you at risk for kidney stones itself. So perhaps just the diet itself is causing cavities as well as kidney stones, or maybe there is more of something there. It's hard to say, but it's fascinating that there is at least that association been published multiple times, in fact.
Yeah, yeah. There and studies are still kind of being looked at. So, but just knowing what we do know and the fact that uric acid, we find it in the kidney and we also find it in the mouth for people that have periodontal disease, we see that there could potentially be a link there. And so we want to make sure that we keep that in mind. And that's discussed with our dental providers as well, is, hey, Dr. So and so, I have suffered from kidney stones in the past and I tend to build up, tartar. And so I want to see what I can do to potentially prevent this from kind of getting worse, and make sure that, you're in open dialogue and discussion with all of your healthcare providers.
Yeah.
Because it's really important to kind of get the big picture of what's going on systemically.
Absolutely. We can help you a lot more when we know what's going on. I
Oh,
feel like people are sometimes worried, or maybe like for a dentist, they think, why in the world do you need to know that I'm taking this blood pressure medication, right? But like all of everything is connected. So it's really important that we know everything, no matter who you're talking to.
exactly.
Yeah. All right. So I think we kind of talked about this next point a little bit more, but do you have anything else you want to add to the general idea of what can people do to keep their mouth and teeth healthy more than obviously go to their dentist?
Right.
Yeah.
So, I think it's really important for you to really care for your teeth, while at home. And I think that a lot of people don't really understand the sequence and the importance of what you can do at home and how big that effect can have on your oral health. So essentially, the way I tell my patients to care for their teeth is when you're brushing your teeth, you want to make sure that you follow the same routine all the time. Consistency is key. So, we want to brush our teeth twice a day, morning and night. And then we want to floss prior to brushing your teeth. So you want to make sure that you floss all your teeth, all the surfaces, getting into the gums. String floss is best. And you essentially, after flossing, you want to make sure that you brush your teeth properly. And the way to do that is to really split your mouth up into two sections first, right side, left side, and then you split that into upper and lower. So essentially you're focusing in on quadrants, 4 quadrants in the mouth. And you're focusing on that for about 30 seconds each quadrant, brushing the front surface, the top surface, and the back surface of your teeth. And the reason why I like splitting up into quadrants, which a lot of people don't do, is because, we tend to favor one side over the other side. Like I'm right-handed and I'll brush the left side all day because it's
It
where I
feels
feel
better.
like I naturally can go.
Yeah.
So it's good to kind of have a system that's in place so you can really focus on not only brushing, but properly brushing your teeth. Additionally, for somebody that feels like they may have one or more factors that I discussed, for, potentially risks of getting gum disease, periodontal disease, or dental cavities, it's a great thing to do is to leave the toothpaste on your teeth overnight. So you can actually brush your teeth, and just spit out the excess toothpaste and let that toothpaste or product sit on your teeth, and you can sleep with it. Especially for your patients that drink lemon juice, that are going to be more likely to, or at a higher risk of erosion. Keeping that toothpaste on your teeth overnight will help remineralize that enamel, keep it strong, fight any bacterial cavities that may be in our mouths. Our salivary flow isn't really going at night as well as it does during the day because it's not being triggered by food or speaking or any consumption. So we want to make sure that, we're doing all the good things for our teeth. So if you do tend to be prone to cavities or you do have suffer from gum disease, keeping the toothpaste on your mouth can be really helpful.
Any
And I
kind of
will,
toothpaste?
what is that?
Does it matter any kind of toothpaste? Like that any, yeah.
Yeah. So I mean, we can talk about this all day, all the products that are on the market. So we won't get into that. But there's so many products on the market, and there's a lot of products that could be geared towards your specific needs. So it's definitely something you want to talk to your dental provider about. There's also a lot of things. So like, let's say a patient's on medication and there's a lot of dental side effects of that medication. There are also some prescription strength dental products out there like toothpastes, mouth rinses that you can also talk to your dental provider about, and they can actually prescribe you something that's a bit stronger if you feel like some of these over-the-counter brands are really not helping. So definitely something to kind of keep in mind, but that aisle can be very overwhelming. So if you're confused on what to use, talk to your dental provider. They know your mouth best.
Yeah, that makes sense. Another question that I have about sort of routine home teeth care is what are your thoughts on electric versus manual toothbrushes? I feel like this could probably be a hot topic.
Hot topic, very hot topic. Um, so I personally love electric toothbrushes. I think that they tend to kind of do the work for you. Um, it also helps the kind of like rotation in the toothbrush helps kind of break down that harder plaque and tartar a lot easier. And also a big thing is that people tend to overbrush when they're doing it manually. So if you're manually brushing your teeth, it's hard to kind of know how much pressure to put on your teeth. My male patients especially tend to brush really hard. But the harder your brush doesn't mean that you're doing a better job. So the electric toothbrushes are fantastic because you really just have to put mild to moderate pressure when brushing, and they kind of do the work for you. There's also some great ones out there that have pressure sensors. So they'll actually like notify you when you're brushing too hard. They'll kind of turn red or they'll vibrate or make a noise. So those are awesome if you think that you are heavy brushing or do kind of suffer from erosion or gum loss. Electric toothbrushes are fantastic.
All right, so it is worth it. I like brushing manually. I don't.
People do.
But like I don't know. So it's good to know that my electric toothbrush is worth it, and I guess I'll stick with it.
And I will say, when I have patients come in that have switched, because I do, tend to get a lot of my patients to switch over that are heavy brushing, I can tell a difference when I clean your teeth. So if I can
Better.
tell
All
it,
right. It's
yeah.
worth it.
So
Okay.
just put that out there. It's up to you.
Yeah. Okay. I think the last thing that we wanted to touch on, or I wanted to make sure we touched on, was the importance of making sure you give your dentist a full list of the medications you're taking. We already kind of talked about this, but bisphosphonates, I think, are very relevant for an audience of people with kidney stones because bone disease goes along with that. So just kind of touch a little bit more and really drive that point home of how and why it's so important to make sure you do list all the medications that you are taking and supplements too, likely.
Absolutely. So, osteoporosis is really a big one in the dental field. And, as many people suffer from osteoporosis, we know that, the bone loss or the decrease in bone density is a big proponent. And you have to think your teeth are really held by one big bone. So, losing bone can really truly affect the foundation of your teeth. Additionally, if your osteoporosis has gotten to a point where you're needing to take a bisphosphonate, you need to make sure that you mention that to your dental provider. The reason being is bisphosphonates, though it's rare, they do have some major dental risks associated with them. And we call that rare, the rarity, it's called osteonecrosis of the jaw, which essentially the jaw itself will not heal, and the bone will not remodel in that area. And typically you're at risk if you have to get or a tooth taken out, if you need any sort of dental implants, or if you're thinking about doing any orthodontia or like aligning your teeth. So you want to make sure you mention that to your dental provider, because of such the the large effects that it could have, you want to make sure that they're aware of that. So they can make sure if you ever do need to kind of get a dental procedure, they're doing all that they can to mitigate those risks. So if you're on and a lot of patients tend to forget that an injectable bisphosphonate is so important to let your dental provider know about. We tend, a lot of my patients that get the injectable bisphosphonates, they kind of forget that they get them. It's like every 6 months, out of sight, out of mind. It's not a medication I typically take. So just make sure that you remember, even if you're getting it injected, you make sure you let your doctor know. And so that way, if you do need a tooth taken out or any sort of more invasive dental procedure, that they will potentially have you go get a bone density scan, do the right scans, so that way they can mitigate any of those risks.
Awesome. Awesome. Any other medications that are especially important to mention? Obviously, just mention all of them, but are there any other common ones in general that come to mind?
Yeah, I think bisphosphonates are a big one. Of course, if you're on any sort of diabetes medication, those are also a big one. Diabetes can cause the healing rate to slow. So a lot of times if you have any dental injuries or any treatment that can be done, sometimes the healing rate can decrease. So make sure that, if you're a diabetic, you mentioned that as well, and the medications that you're taking. I know a lot of kidney prevention medications too can cause dry mouth, they can cause bad breath, they can cause things like that. So, essentially full medical history to your dentist, don't leave anything out, and make sure that you discuss your concerns with them. Oh, the thiazide diuretic can cause dry mouth, and I know that's a big one for kidney stones. So make sure that's mentioned.
Yeah, absolutely. All right. This was amazing. So much great information. Anything else that you want to add before we close?
Um, I think we touched on a lot of topics.
We
I mean,
did. We talked about a
for a
lot.
very long time. Oral health is like my favorite. One last thing I do want to talk about is, everybody's treatment plan, as you know, you're a dietitian, so you know that everyone's treatment plan is really geared towards their individual needs. So if you feel that you are somebody that suffers from heavy buildup in your mouth, dry mouth, you tend to get cavities more frequently than somebody else. You want to make sure that you discuss that with your dental provider. And when I have patients that seem like they're at high risk or they have, multiple factors that come into play, I sometimes will recommend, cleanings every 3 to 4 months versus every 6 months. I may recommend, somebody that may have osteoporosis and is concerned with bone levels. I may recommend, an extra x-ray a year just to kind of make sure that the bone is stable, we're not losing bone. All of these things can, although preventative, right, can make such a big difference in the grand scheme of things. So if you feel like you would benefit from an extra visit to your dentist, an extra cleaning, an extra x-ray, make sure that you bring that up to your provider, because it really can make all of the difference for patients.
Awesome. All wonderful points. All right. Well, thank you again so much for taking the time. I know you're very busy and I
Yeah,
really
I truly appreciate
appreciate you taking the time to talk to us. I learned a ton today, and I'm sure that our listeners will also really enjoy this episode. So if anyone is in the Chicagoland area, where can they find you?
Sure. So my office is located in North Center. The address is 3864 North Lincoln Avenue. And the office is Freshworks Dental Studio. And I'm Dr. Mimi Salem.
Awesome. Yeah. So if anyone is in Chicago, go check out Dr. Salem. You can also talk about food during your appointment. Mostly, of course, you talking to me because your hands are in my mouth, but you know what I mean. So
I will see you in 6 months, Melanie.
yeah. All right. Well, thank you again so much. And I hope to see everyone else on the next episode of the Eat Away Kidney Stones podcast. Have a wonderful day. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.